House does now adjourn.
The question is that this House do now adjourn. Hannah Bardell.
Thank you very much, Madam Deputy Speaker, and I am incredibly grateful for the opportunity to hold this debate and for the flexibility of the Speaker's office in moving this when I was ill last week. Because this last week was Crohn's and Colitis Awareness Week, an opportunity to break the silence on inflammatory bowel disease and highlight the impact of these terrible conditions on people's lives. And I want to thank particularly Crohn's and Colitis UK, who've given us a huge amount of support, and the Honourable Lady, my honourable friend, I would like to call her, for Chesham and Amersham, who jointly with me recently reconvened the all-party parliamentary group on Crohn's and Colitis, and also Alison in my office, who has supported me in writing today's speech. Because over 500,000 people in the UK, 1 in every 123 people, live with Crohn's disease or ulcerative colitis. These are debilitating, lifelong conditions which develop when the immune system attacks the gut, and there is currently, tragically, no cure. Symptoms include urgent and frequent diarrhoea, rectal bleeding, pain, profound fatigue, anemia and inflammation of the joints, skin, liver and eyes. These conditions are widely misunderstood, with its invisible stigmatised symptoms often leading to isolation, a lack of support and poor mental health. That's why this Crohn's and Colitis Awareness Week we wanted to break the silence on inflammatory bowel disease, raising greater awareness of the conditions and helping those many people and many of them our constituents living with them to speak more openly about the impact on their lives. I'd be delighted to give way to the honourable gentleman.
Could I commend the honourable lady for Livingston? I actually was looking forward, if it's the right thing to do, looking forward to her adjournment debate last week, and I understand it's good to see her back in health and strength again. Incontinence is a common symptom of Crohn and colitis, experienced by as many as 3 in 4 people with Crohn's or colitis. Understandably, incontinence, or the fear of experiencing incontinence, can cause anxiety about leaving home, which can seriously affect your work and social life. Does the honourable lady agree that more work must be done with the DWP to train PIP assessors on the impacts of Crohn's and colitis to ensure those suffering have the best possible chance of getting the benefits that they're entitled to?
I thank the honourable gentleman for that intervention, and he has read ahead almost my speech, because I will absolutely come on to that, but it's an incredibly important and salient point that he makes, that we need to make sure that PIP assessors and the whole framework can take into consideration those with relapsing and remitting conditions such as Crohn's and colitis. And with permission, Madam Deputy Speaker, I'd like to share some of those experiences with the House, because one of them is my brother. When he was diagnosed with ulcerative colitis just over 9 years ago, he was in his late 20s and a new dad to a premature little girl. Whilst we were cooing and worrying a little about this new bundle of joy, who is now a strapping 9-year-old, my brother was struggling and had been for some time. I think, in truth, he was terrified about how fatal the diagnosis might be. It was not until much later that it dawned on us all just what he'd been through. And when his diagnosis finally came, it was truly devastating. His life and that of our family was, for a period, really turned upside down. An active and fit football lover, a new dad, and an outgoing and often, frankly, a bit too cheeky young man was stopped in his tracks. And as a frontline police officer with big ambitions and talent, my brother had to adjust to a very different life, existence and career path. The pain, the fatigue, the various symptoms that he, like many, experience suddenly had a name. And aside from the initial period of time out of work to recover and adapt, it meant that things like our annual holiday to the West Highlands to go camping was suddenly in jeopardy. A 4-hour drive, where it couldn't be predicted if toilets could be open or available, was suddenly something that was potentially out of reach. My brother, however, being the resourceful problem solver that he is, traded in his car for a pickup truck and popped a portable loo in the back, meaning that while he adjusted to his anxiety and being able to find a toilet when travelling, these things could be managed. I don't believe he ever used it, but it was there just in case. And I think now he would count himself as one of the lucky ones. And that's just the point. For those who suffer from any kind of inflammatory bowel disease, and let me say and acknowledge that there are people with endometriosis, with conditions such as cancer, suffer very similar challenges. Finding a loo that is working and stocked and clean is a perennial problem. So perhaps the Minister might like to meet with me sometime to discuss how we can develop better facilities, maybe even some kind of interactive map in an app of loos that will do. Now, my constituent Stephen Sharp, who I want to pay tribute to, is a brilliant young man excuse me, from Fauldhouse in my constituency. He is a Crohn sufferer and he has raised thousands of pounds for the charity over the years, including doing a bungee jump. And Stephen has often spoken to me about the joint pain, the fatigue and the unpredictability of the disease and the impact on his life. And he also lives with a stoma. And that's one of the major challenges, the symptoms that can change and be different every single day. Stephen and I recently met the Prime Minister, and I have to say the Prime Minister was incredibly supportive and kind to Stephen. I hope that that kindness will be extended into provisions to make sure that those living with Crohn's and colitis can get the support they need. And my friend Rachel Agnew, who I hope is watching and I spent time with this summer, also talked to me about the many years of illness she's had from Crohn's disease and a possible misdiagnosis, having had many major operations, and now she has Stan the stoma, who can sometimes be cantankerous but has ultimately saved her life. Rachel recently had to give up a job she loved, and she is now having to navigate the complex nature of the benefits system whilst having a relapsing and remitting disease. Research commissioned by Crohn's and Colitis UK revealed that the scale of Crohn's and colitis has been vastly underestimated, with twice as many people living with the condition as previously thought, and particularly, as we heard in recent debates and briefings, young children being diagnosed earlier and earlier in their lives. And I think we do have to pause and consider why that is happening. What are the environmental impacts? What are the impacts of processed and overly processed food? Because I have no doubt in my mind that they play a part. And we need to fund that research to make sure we get to the bottom of those things. I would be delighted to.
Thank you for giving way. And I thank her for securing today's adjournment debate to raise awareness of Crohn's and colitis. Symptoms like abdominal pain, diarrhoea and fatigue are too often dismissed, Madam Deputy Speaker, especially when they come and go. And a poll by Crohn's and Colitis UK found that over 1 in 10 people would put off speaking to a healthcare professional if they had diarrhoea with blood or mucus and stomach pain, because they'd simply find it too embarrassing to speak to a healthcare professional about their symptoms. So does the Honourable Lady agree with me that a public awareness campaign of lower gastrointestinal symptoms is needed to help people access reliable healthcare, access reliable advice and take control of their health?
Hear, hear. My honourable friend for that intervention. She's absolutely right. Excuse me. We absolutely need to have greater awareness. People need to not have to live with that stigma or not be scared to talk about their poo, frankly, and being able to go to their doctor and discuss that openly and for their doctors to be able to offer the right care. Because only 1 in 4 people are diagnosed before they're 30, thus affecting the most productive years of their life. And Crohn's and colitis are complicated diseases, as we know, that follow a relapsing and remitting disease course. We need, therefore, a benefit system and a social security system that supports people with those kinds of conditions. And is, as my honourable friend has said, absolutely crucial that we can raise awareness. People are waiting far too long for a diagnosis, Madam Deputy Speaker, of Crohn's and colitis. Even before the pandemic, 1 in 4 people waited more than a year to be diagnosed, with nearly half ending up in accident and emergency at least once before their diagnosis. And delays to diagnosis affect people's ability to continue education and work and narrows their treatment options while increasing the risk of being hospitalised. Ultimately, and we do not want anybody to feel a burden to the NHS, but there is a greater burden on the NHS because people are diagnosed much later and aren't able to access that care. Research from Crohn's and Colitis UK has found that only 1 in 2 people had ever heard of these conditions, and even fewer could name those symptoms. So to make matters worse, people are not facing up to that, not understanding it and putting it down to other things. So you could say, Madam Deputy Speaker, it's time to talk more crap than we already do. If sufferers struggle to discuss incontinence with their health professionals, it can have a profound impact. But these discussions are vital to ensure those with Crohn's and colitis receive the support and the accommodations they need. And I would like to highlight the work of the SNP-led Scottish Government, who are committed to ensuring those living with Crohn's and colitis are able to access the best possible care and support they have, and to access health services that are safe, effective and put people at the centre of their care. For example, in March this year, the Scottish Government launched an awareness campaign to help increase awareness of Crohn's and colitis symptoms and to signpost reliable information so people feel empowered to seek help from a medical professional when needed. I would be delighted to hear the Minister, when he gets to his feet, say that the UK government will do the same, and that they will work across the UK and indeed internationally with those who are leading the field in research. Bowel conditions are notoriously difficult to diagnose, and so we must remind people that some of those conditions, such as IBS, celiac disease or bowel cancer, can be similar to that of those who suffer with Crohn's and colitis. So it's crucial with those who with Crohn's and colitis have those conversations and that they get a diagnosis as early as possible. Because if left untreated and poorly managed, these conditions can cause serious complications which require emergency medical or surgical intervention. And when we had an all-party group meeting recently, we heard from a sufferer who had had the most horrific experience during COVID. She was taken by ambulance after terrible weight loss, and just hearing that experience, particularly during COVID, brought home to us how awful it can be and how difficult it is for young people, particularly, to face up to something that is going to be lifelong and debilitating. And IBD care is often overlooked and under-resourced. The current resource planning is based on outdated data and the number of people living with these conditions, which we know is twice as many as people that was previously estimated. One long-serving IBD clinical nurse specialist recently told us how 18 years ago her service was supporting 250 patients. Madam Deputy Speaker, they are now supporting over 7,000 people living with Crohn's and colitis. That kind of increase is just not realistic for our healthcare staff to deal with. Consequently, there's a significant variation in the quality of care across the UK. No IBD service currently meets the IBD standards, so we need to work together to improve that. But the Scottish Government will continue to improve services with people with conditions through Modernising Patient Pathways programme. It has a specific work stream continuing to promote improvements in inflammatory bowel disease care for patients across Scotland and in partnership with the third sector and people with lived experience. And additionally, the Scottish Government is funding gastroenterology specialty groups which leads on research into Crohn's disease and ulcerative colitis, with a focus on a range of areas, including early diagnosis of these conditions. We look forward to seeing the results from IBD UK's benchmarking surveys, which are being undertaken just now, and that's going to have data from over 15,000 patients and 63% of IBD services. I hope the Government will take that into consideration and give that its very close attention. And as we've discussed, Crohn's and colitis does not just affect the gut, it can affect almost every part of the body and every aspect of life, from digestion, eyes to joints and energy. However, many people tell us that the hardest part of living with these conditions is the prejudice and discrimination that comes with living with a hidden disability. Now, the awareness cards that are now available that Crohn's and colitis and other charities are providing do help. But what we also need is not just awareness for people who suffer from Crohn's and colitis, but the public at large. When somebody goes to use a toilet that has a disabled sign on it, just because they don't have what looks like a physical impairment doesn't mean that they don't need to use that toilet. 3 in 4 people will experience bowel incontinence, therefore quick access to a suitable toilet facility is crucial, either to prevent or act should an accident occur. And the anxiety, I'll be very happy to give way.
I thank the Honourable Member for giving way, and she is really making a very powerful contribution in the House tonight. I believe around accessible toilets, I think that is an absolute key part of part that this government can undertake to really help people who have Crohn's and colitis. I know in my own constituency of Upper Bann, we have rolled out a fleet of accessible toilets. Would you agree with me that that's something that should be mirrored right throughout the United Kingdom, and that more focus should even be placed on the radar keys that are available for disabled toilets throughout the United Kingdom?
I thank the Honourable Lady and I congratulate the work that's been done in Upper Bann, and perhaps there is lessons that can be learned and examples that can be taken by all governments across the UK, because incontinence can cause, I know, considerable anxiety. I've talked to my brother often about the thing that is worse now, and when he has a flare-up it can be really seriously debilitating, but the day-to-day anxiety is something that never goes away and is always with those who suffer. What's more, some Crohn's and colitis sufferers have stoma bags, meaning not only do they need to find a toilet, but one that has enough space for them to change and dispose of equipment comfortably, hygienically and in privacy. And I know there was an excellent event recently in Parliament for International Men's Day that talked about the need for sanitary bins in men's toilets as well, and I think that's incredibly important. You know, men often suffer from incontinence, and they certainly suffer from Crohn's and colitis. So making sure that all toilets have those facilities that are safe and sanitary is absolutely crucial. And I'm not sure whether it would require an act of Parliament, but it strikes me that this would be something that would have support across the House. Because the fear of incontinence or being able to locate a toilet can lead to mental well-being breakdown and lead to social isolation through people choosing simply not to leave their home. We've all been there. We've all had a sickness bug or an upset tummy and either nearly not made it or not made it. Imagine that is your life every single day. So many living with Crohn's and colitis are going to understand, and I hope will hear the calls that come today. But one of the key things that we've heard time and time again is the social security system, because less than 3% of people living with Crohn's and colitis are in receipt of personal independence payment. 4 in 5 are denied the support they need. Words like battling and fighting are often used to describe the experience of those applying for PIP. And I spoke to someone recently who talked about how degrading they felt the system was. And that was somebody who was chronically ill and was often in the situation where they couldn't leave the house, to then be put in the situation that they are scared of going through a system that is supposed to be a safety net is utterly appalling. And I hope that the Minister will hear that and talk more about how the social security system can support people with Crohn's and colitis. Because a system defines the current benefit system defines disability as a permanent and substantial impairment or a person with a long-term health condition which is likely to degenerate. And you cannot tell me that some of the examples that I've given, or those who we've taken evidence from, and those who will be watching at home tonight, that their condition is not long-term. There is little recognition of fluctuating health conditions. And fluctuating health conditions aren't just Crohn's and colitis, there are many other conditions. So we have to have a system that is designed to support all of those people.
Will my honourable friend give way?
I'd be delighted to.
I'm very grateful to her for giving way. I think she's making a really powerful speech, and I hope that the Minister does hear the point she's making. One of the things that constituents do consistently raise with me in terms of Crohn's and colitis is the impact of benefit assessors' lack of awareness of the impact and the fluctuating nature, as she's describing, of the conditions, and also the need, as they see it, to end informal assessment in the PIP process. Does she share their concerns about these particular points?
Yeah, I absolutely do. I mean, fortuitous that she raises that, because the statistics tell us only 1 in 2 people score points under the toileting needs and continence descriptor, despite the severity of the system and of the symptoms in everyday life. And the fact that 3 in 4 people with Crohn's and colitis will experience it just shows how profound the issue is. So I would like to highlight, however, that the Scottish Government is reforming flexible disability assessment for fluctuating diseases. That is good news for people in Scotland, but what about people across the rest of the UK? And it is consulting with those with lived experience on the mobility component of their adult disability and payment. Now, that includes researching the impact of moving around, planning and following journeys for those with fluctuating conditions. The adult disability payment differs from the personal independence payment, as it intends to get decisions right first time by trusting what people tell Social Security Scotland. Time and time again, I've heard people who have been through the assessment process for PIP and have been undermined and scared. And I know people that just have not gone, including some constituents who've come to see me. They don't want to go through the process because they're so scared of it. We must move away from that. Treating people with dignity, fairness and respect is absolutely at the heart of delivering adult disability payment. So, Madam Deputy Speaker, what I've highlighted today covers just some of the impact that Crohn's and colitis has on people's lives. It's vitally important that we invest in developing a national primary care diagnostic pathway for lower gastrointestinal conditions, as my honourable friend has suggested, and destigmatising IBD symptoms and creating a benefit system that supports people with all types of disabilities. Just as the Crohn's and colitis campaign said, Madam Deputy Speaker, it's time to cut the crap and give greater awareness to IBD and those who suffer from this terrible life-limiting disease. We have an opportunity to do something really good, to give those who suffer from these terrible diseases an opportunity to take their full role in their communities and do jobs that they may otherwise be unable to do if they don't get that diagnosis and that support as early as possible. So I hope the Minister has heard what we said. I hope he's heard the experiences of our constituents and those close to us, and I look forward to his contribution. Thank you.
Minister Andrew Stevens.
Thank you, Madam Deputy Speaker. And can I start by congratulating the Honourable Member for Livingstone for having secured this debate on this very important issue. She is a tireless campaigner for those living with bowel conditions, in particular Crohn's and colitis, and she's spoken movingly this evening about her own family's experience of the condition. And can I also pay tribute to the Honourable Member for Cheshire and Amersham, the Honourable Member for Strangford, the Honourable Member for Upper Bann and the Honourable Member for East Renfrewshire for their contributions. I will try to address as many of the points that have been made in the time allowed. I think it's very important that we all do everything we can to break the stigma and ensure that sufferers' voices are heard. I think the Honourable Member for Livingstone has already done invaluable work in helping re-establish the APPG for Crohn's and colitis. I'd also like to pay tribute to the charities who support 500,000 people living with inflammatory bowel disease across the UK all year round. Crohn's and Colitis UK, the Crohn's and Childhood Research Association and the Crohn's and Colitis Foundation, to name just a few. On this issue, as with so many others, it is vital that we do everything we can to break down the barriers to those affected from accessing healthcare. As Crohn's and Colitis UK have said, it takes guts to come forward with your story, and I salute their Cut the Crap campaign. I look forward to working with the Honourable Lady as we find solutions to improve the lives of people living with this disease. As she's rightly said, living with Crohn's and colitis can be a daily struggle. Symptoms of the disease can be embarrassing, leading to people feeling isolated and not reaching out for the support they need. I'd like to focus briefly on three things my department and NHS England are doing to help sufferers. Firstly, raising professional awareness, improving diagnosis, and then research. I'd like to begin on the crucial point about raising awareness, because it's key to getting people diagnosed as early as possible. There are two kinds of awareness. First is raising awareness amongst the public, something that the Honourable Member for Cheshire and Amersham talked about before. Stigma is the invisible wall preventing people from seeking the help they need. And campaigners are central to smashing that stigma because of their reach into communities across the country. Campaigners like the Honourable Lady's constituent, Stephen Sharp, who she referenced in her speech, have done so much to raise awareness and break down that invisible wall. Campaigners encourage people to get to their GPs and to ask the right questions. And I'm keen for us to be backing people like Stephen every step of the way. By helping GPs to recognise the symptoms of Crohn's and colitis through NHS England's Getting It Right First Time gastroenterology programme, the programme ensures conditions are diagnosed as quickly as possible through supporting primary care services, driving appropriate referrals and managing inflammatory bowel disease in the community. The programme is estimated to reduce emergency admissions by more than 6,500 a year. And it's been commended by the King's Fund, who are not always in the habit of showering praise on the government. It's also right that doctors should be properly trained to treat the symptoms of Crohn's and colitis as they appear. And in the past 5 years, NICE has produced a range of guidance to ensure that the care they provide for Crohn's is based on the best possible evidence. Madam Deputy Speaker, early diagnosis can make a clear difference to people's quality of life. And we're working hard to improve early diagnosis rates through the Getting It Right First Time programme, through measures that include more 6 and 7 day services and extended hours. These measures are reviewed and expanded endoscopy capacity and improved patient flow. NHS England is working closely with frontline clinical experts, patient representatives and leading charities to develop evidence-based tools that improve care. This includes work to ensure the right care scenario is provided on inflammatory bowel disease. This will set out our expectations of high quality, joined up care at every point of the patient journey, from diagnosis to treatment. Officials assure me this is being finalised and will be delivered in the coming year. What's more, NHS England's National Bladder and Bowel Health Project is delivering better care for people with inflammatory bowel disease with a focus on developing clinical pathways. Making a diagnosis of Crohn's and colitis can be difficult and frustrating for patients, as the condition can be confused with irritable bowel syndrome. So I'm pleased NICE have recently made fecal calprotectin tests available on the NHS as a non-invasive, inexpensive method for assessing patients before invasive procedures are required. As the Minister responsible for life sciences, I'm also passionate that we can do everything we can to accomplish better patient outcomes through investing more in research. It's key to gaining a better understanding of the causes of inflammatory bowel disease, leading to better diagnosis, treatments and outcomes. Sorry.
Can I thank the Minister? That's a very comprehensive response, and I'm sure all on this side are encouraged by that. However, the Honourable Lady for Livingston and myself did ask specifically about the issue for PIPs, and it's something we're very, very concerned about. I know it's not the Minister's responsibility, but I can just ask us this point. Can the Minister perhaps give us some indication that he would speak to the relevant Minister to make sure that there are movements to help and improve? Thank you so much.
I'm very happy to give the Honourable Member for Strangford that undertaking. As he rightly acknowledges, I am not a DWP Minister. I do not want to tread on their toes, but I think there was clear views expressed tonight which I will be relaying to DWP ministers, because I think it's very important that we get the benefit system right to support all people living with conditions such as these. If I just return back to the research point, Madam Deputy Speaker, we're investing over £1 billion a year in health research through the National Institute of Health and Care Research. We're funding 60 projects into Crohn's and colitis research, backed by over 33 million in the last 5 years. I appeal to every scientist who may be interested in research in this area to keep applying for grants through the NIHR. I will leave no stone unturned in finding out what more can be done to address the needs of people affected by these conditions. And I look forward to working with the Honourable Lady to create the kind of care that people deserve. Whatever political differences we may have, and I'm sure we will agree, that 500,000 people living with inflammatory bowel disease are entitled to the highest possible standards of care and support. I will continue engaging with her and with NHS England to make sure the Getting It Right First Time programme is delivering results for patients on the ground. I began this speech by talking about the invisible wall preventing people from accessing the healthcare they need. Let's tear down this wall together.
Question is that this House do now adjourn. As many as are of that opinion say aye. Aye. The ayes have it. The ayes have it. Order. Order.